Welcome back, Richard. It's good to see you again.
Middle of March, huh? We're almost at the Ides of March.
See, we're right in the middle. It's March 13th, and today we're going to talk about a topic that we haven't talked about in a little while.
Right.
We're going to talk about.
I knew you were gonna. You couldn't help yourself, right?
Well, we've avoided talking about it. We've been talking about some other issues and things that's been going on, but there's been some recent articles and information that's been released about long COVID, which we've talked about before.
Right.
People who were infected with COVID and the symptoms just seem to linger and last for a long time. And the more and more people that I talk to at my schools that I work at in different places, they talk about that. They say that, they're testing negative and, they haven't had, it's been, a month or more since they've been, really had the active symptoms.
Right.
But still every once in a while, they'll be doing something and they just get winded easier. There's, as we'll talk about today, there's all kinds of other effects that are going on. So we thought that we would talk about long COVID again and kind of update everybody with the new information.
Right. The term long COVID, that's sort of the popular term. Mm-hmm. The medical term I just learned is called post-acute sequelae of SARS-CoV-2 infection. Big long word. We're not going to use that. The abbreviation is PASC. We'll just call it long COVID, or I guess long COVID is the best shorthand term to use. Right. Okay, because there are millions of people who were infected, are still struggling with some of these symptoms, and the research is just beginning. And I think that's why these articles are starting to appear, because now that the acute phase of the pandemic is over, it's giving researchers an opportunity to take a look at long-term. And I think some of these studies are beginning to appear. This research takes a while to conduct. And so most of this is preliminary research, but it seems to be worth reporting just to bring people up to date. Also, people are talking about it. They read different articles and they say, oh, I heard that COVID does this and COVID does that. So I thought, well, let's take a look at that and try to clarify some of the issues involved.
Right. And I think that, most of the news reports that we hear now are that it's slowing down and, things are getting a little bit better. But it is important for us to recognize that, we are quickly approaching, 1 million deaths in just the United States, which, we have the highest rate, right, in the world.
We have the highest death rate, highest mortality rate in the world. Yeah.
Right. And we've, on a day-to-day basis, we're still losing thousands of Americans that are dying from COVID still. Even though the numbers are lowering or dropping, we're still the interesting statistic that across 2 days last week, more people died of COVID than died in the 9/11 attacks. And
we had several thousand people die at 9/11, and in 2 days of this, every 2 days we have more than that die of COVID. So this is and to put that into perspective, COVID is now the third leading cause of death in the United States. Yeah, you don't think of it that way, but there's heart disease, cancer, and COVID is third.
Right.
It's astonishing numbers.
So we have the mortality rates, and then we have to also think about what else is happening. The long-term effects of COVID, and that's again really what we're going to be talking about today. Are some of these long-term effects? There's been recent reports about that we're going to talk about. Just focusing on the physical effects, the physical long-term effects of having had COVID, as well as the mental health long-term effects from having COVID.
Right. I don't know whether this book is still published, but when you and I worked in medical schools, there was a book that we regularly saw called Mortality and Morbidity.
Right.
And it was the statistics of what are people dying of and what illnesses are affecting people. And so with COVID, we have mortality, which is how many people are dying. But now we have a morbidity issue, is what are the illnesses related to this? And one of the things about this virus is that there are hundreds of possible symptoms, but it affects every body system.
Right.
It can affect your brain, your lungs, your gut. I mean, we know it affects your lungs because that's what people died of, lung disease, but it can affect your gut, it can affect your brain, it can muscles, bones. It seems like this virus can sort of find a place anywhere in your body and create havoc.
Yeah. So even though the numbers are dropping, it is important that we look at this idea of long-term COVID or long COVID and think about what that is. We don't want to celebrate the pandemic or anything like that too soon. We've hopefully learned that our lesson with that a couple of times now, where we started to celebrate, and then along comes some other variant, and it is anticipated that there will be another variant. But I think it is important that we talk about long COVID because, as you just said, there are hundreds of possible symptoms all across our body that COVID seems to be related to.
Right. And, we all want to be done with COVID, of course. We're all tired of it. We're tired of the arguments. We're tired of the disease. We're tired of everything. But like it or not, thousands of people are being infected every day. And of those thousands of people, many of them are going to have long-term symptoms that are creating a health and mental health. It's actually creating a mental health crisis in the country because there are currently a little under 10 million people who are experiencing the direct effects of COVID, either mental health disorders or cognitive disorders. So it's already with us. And the crisis is already being created, and it's going to continue. Not as many people are dying of COVID, but many people are still getting infected by the virus, and they're going to have these long-term symptoms.
Absolutely. So the first article we're going to talk about is from health.com, and it is focusing on the mental health issues. And we've talked before about how the pandemic itself seems to have increased some of our risk, or some of the prevalence, at least, for some mental health issues because of the isolation and the quarantining and the on and off again and all that kind of stuff. But there's some new research to suggest that simply by having COVID, having been infected by the virus itself, there is an increased risk for long-term mental health issues.
That's right. And the numbers are pretty significant. They're in that 25 to 40% range. First of all, I should say that about 5% of people, you say, well, only 5% of people are directly affected by COVID. But you say it was only 5%. But when you think that 146 million people in the country have been infected, 5% is, we're talking about just 7 or 8 million people. So it's still a significant number. Of that number, what this study showed, and this study was done on a large group, about 158,000 veterans. So we have access to their records, veterans who had the disease, who were infected by the disease. And it was discovered that the chances of various mental health disorders increased, and they gave it in percentages. So if you had the disease, you were 35% more likely to experience anxiety disorders, 39% of depressive disorders, 38% of adjustment disorders. And so these are fairly significant numbers. And then you have all the substance abuse disorders that came with this. Opioids were the worst, 34%, but other substances, including alcohol, was a 20% increase. 40% of people had sleep disorders. So these are fairly significant numbers. The most staggering of all is that there's an 80% chance that you're going to experience cognitive impairments such as brain fog and confusion. I mean, people are losing their jobs, and they're losing functional abilities because of the long-term cognitive effects of having the virus.
Yeah, and I think that's certainly one that we hear about the most. It's just that we don't, and until some of this research is coming out, we don't really put our finger on it. It's really difficult to say, oh, this is what's causing it. But it is certainly the brain fog and the confusion and difficulty focusing and not quite sure, just we're not sure why it's happening or what's going on, but it's just difficult to make some of those connections and process some of that information. And it's great that this research is coming out so we can make some of those connections and understand it. We need to develop interventions and strategies for dealing with it, but not knowing why it's happening can sometimes be worse than what's the actual symptoms themselves.
That's right. When it comes to mental health disorders, we're confronted with two huge problems. One is we don't know exactly what the virus is doing, how it's related to mental health. The second thing is the typical medication treatments for the disorders don't seem to work as well. If you never had COVID, prior to COVID, you took an antidepressant and you would expect relief of symptoms. The problem with long-term COVID mental health effects is the typical medications that we use don't work as well. So that's a second problem. Not only do we not know why it's happening, but our treatments aren't as effective with COVID-related mental health disorders.
Right. So that is, so there is some evidence. We're kind of moving in this direction of some evidence that perhaps COVID is affecting the brain itself, the neurotransmitters and the not necessarily the structure of the brain, but the functioning of the brain. And so it's sort of shifting some of the way that the neurotransmitters like serotonin and things like that are communicating with themselves. And that is contributing to this. So it's very similar symptoms, but the root cause or the, I guess, chemical cause, the biological cause may be different than authentic or what we've traditionally known as depression and anxiety.
Right. That's right. The word inflammation keeps coming up when you talk about COVID, and most people believe that inflammation is in some way the culprit. And inflammation, of course, comes from, the body has an invader. The coronavirus comes into the body, and the body mounts this defensive attack in the form of inflammation. It's what a fever is. Right. And so some experts, I think most experts agree that there's something about inflammation that is affecting the brain's chemistry, and it affects the cells. It affects how the cells respond. And when you affect cell functioning, you affect the neurotransmitters.
Absolutely.
Like serotonin. Serotonin would be one that would be affected. And so you get symptoms that look like depression because they're related to neurotransmitter faults. There's a second line of research that suggests that that brain cells could be damaged directly, but that line of research has been much more difficult to establish with any certainty because it just takes time, and we just don't know. But there's plenty of evidence that suggests that neurons themselves are affected, but also the white matter of the brain, the connections among neurons are also being affected. But when you get to that level, that's very difficult research to do, and we just don't know. But there seems to be some direct neuronal damage that is caused either by the virus or by inflammation.
Right, and that research is really difficult. I mean, if you think about it, you won't necessarily have what they would call pre-morbid or brain scans from before the virus.
That's right. You don't have
to see what's after the virus,
because you do a brain scan. I had a very mild. Did you ever you had COVID, right?
No.
Were you never? Okay. I had a very mild case. So if they do an MRI on me today, they might find something. The question is, did those things exist before I got COVID? Because if I didn't have an MRI of my brain, and most people don't, how do you know whether it was caused by COVID or it existed before COVID arrived?
Right. So we have to get lots and lots and lots of MRIs from people who had COVID, and then we just look at generalities. We compare, they call it aggregate data. We aggregate all of that together and say, oh, all of these people tend to have decreased white matter or density in certain areas of the brain as compared to what we typically expect in that many people. So
if we did brain scans on every human,
right,
every person in the United States, then you'd have this is what your brain looked like when you were 25. Okay, this is what it looks like today. But again, is it COVID or was it something else that may have made the difference? So it's exceedingly difficult to do this research. Absolutely. But we think that one problem is inflammation and that it's affecting neurotransmitters. The other problem is it could have direct effect on brain tissue.
Right. But because of that's sort of the idea as to why some of our traditional treatments aren't working, because it's a different cause.
That's right.
Very similar neurotransmitters that are affected perhaps, but it's a different cause. And so we have to do something different to help with that. And there's lots of strategies for dealing with inflammation. It does depend on the type of inflammation. And if your body still feels like it's fighting the infection, your attempts to decrease the inflammation is going to be really difficult.
Right. And many people are complaining about, I just feel tired. I'm just exhausted all the time. And I was in a facility on Thursday, and all the people there that I were dealing with, 5 other people were in the room, their therapists, and everybody said, I'm just tired. I'm just exhausted. Yeah. I always, this little light goes off in my brain, it flickers. And I'm thinking, I wonder if it's long-term COVID, some form of long-term COVID that they had, and they're just experiencing these minor symptoms.
Right. Mm-hmm. So the other articles that we have talk about, kind of expand this a little bit and talk about actual physical consequences to the brain. And it's from the next one is from Axios. Right. But it's actually talking about the effects on the brain and some of these things that we're actually talking about here.
Yeah, the Axios article mentions a couple of different studies. And one of them is a study of 785 individuals. Now, these are elderly people. They range in age from 51 to 81, but they found that the brain actually shrinks. You lose as much as 2.9% of brain volume. Now, here we have a study that compares people who were infected compared to people who were not infected. Right. People who were not infected, their brain size decreased by 0.9%. We know that as the brain ages, it will shrink a little bit in size. People who were not infected had a 0.9% loss. People who were infected had a 2.9% loss. So it's a factor, it's pretty significant. And what is most alarming is that, to put it in perspective, the researchers said, this is it's the same effect as 10 years of aging. It's a decade of normal aging. So when you think of it that way, that your brain is aging by 10 years, that's a pretty significant difference. There's a big difference between a 40-year-old brain and a 50-year-old brain, for example. There's also some thinking that the virus, when we attack the virus, we could be producing or triggering other diseases like Alzheimer's and Parkinson's. The virus could somehow trigger those disorders. So again, we're not exactly sure, but we see this correlation between the virus and these other disorders. And the other study that they mentioned is from Wuhan, China, and we all recognize that because that's where the disease probably started. And there was a markedly higher risk of dementia in those who had severe symptoms. So there's some relationship between having the virus and having cognitive symptoms, including things like Parkinson's and dementia.
Yes. So that's it's fascinating that there's this relationship. And again, that first study with the 51 to 81-year-olds, that's again talking about that aggregated data. So they're taking all those who had it, putting their information together, and taking all those who haven't, put their information together and comparing those two. And that's sort of the best we can do with the research when we don't have a brain scan before and a brain scan after. But it's fascinating, but it raises a lot of questions, because is it reversible? Can we correct some of this with the right treatment or the right strategies or the right medications or whatever? These were with studies. These are studies with older individuals. We know. What about younger? What about kids? Is it the same results?
Because there's all that research. It really started with marijuana research that said, well, marijuana may not affect the adult brain, but it has adverse effects on the teenage brain because the teenage brain is still developing. And so the same question arises with COVID: is does it have worse effects on a developing brain than it does on an adult brain? And that's an important question. Also, teenagers have fewer resources to deal with these kind of insults than adults do. They don't have the ability to do much about it. They just don't have those skills yet to deal with it. So does it affect younger individuals differently than it affects older individuals?
Right. Well, and what about people who had it but were asymptomatic? Do they experience the same thing? So there's lots of questions that remain. And again, they're still doing research and they're trying to figure some of these things out. And another article that we read was from NIH, and it talked about COVID and the nervous system in general. And again, more evidence to suggest that there seems to be some relationship between having had COVID and sort of this widespread immune response that's affecting our brain and nervous system in general.
That's right. And in both the Axios article and the NIH article, the same question arises: is it the infection, the virus itself, that directly affects the brain, or is it our body's response in the form of inflammation that's causing the problem? And we simply don't know. At this point, we don't know. We'll find out eventually. It's probably going to be a little bit of both. It would be everybody's guess. But right now, we just don't know. I think the HIV, the Haemophilus influenza virus, I think attacked the brain directly. If I remember correctly, that was one of the fears that everybody had, is that if you got HIV, it would directly damage brain tissue. With SARS, we don't know. I mean, we just don't know whether it's the virus itself or it's the brain's response to the virus that's causing the problem.
Right. And or if it's the rest of the body's response to that is affecting the brain, because that's how the inflammation happens, is that it's our body's natural immune response that's causing the inflammation that's affecting the brain in a negative way, because we're just not supposed to be in that inflamed state for such a long time. Our body's not made that way.
Yep. Now, what we do know, or whether there seems to be some evidence coming out of NIH, that the virus seems to attach to cells in a way that causes veins and arteries to become thinner and to weaken. Okay. And when that happens, if they break, or if they essentially spring a leak, is what would be happening, is they get thin and they spring a leak, then you're going to get all of the typical neurological symptoms that most of us are familiar with. And those would include strokes. If your arteries thin and they burst, if they burst in your brain and the blood hits brain tissue, it's going to kill the brain tissue, just like any stroke would. Okay. But it also causes dementia. It also causes muscle and nerve damage, encephalitis, all kinds of vascular disorders. So you could damage the heart, you could damage the brain, you can damage the arteries, damage the veins. So there seems to be some correlation there seems to be some information coming out that says the virus attacks the cells and causes the thinning of these walls. and it's the thinning that creates a risk of breakage, and you get the typical symptoms that we associate with stroke and dementing disorders.
Right. Absolutely.
And then the second thing is there's evidence that now that we're talking about cells, we're talking about brain cells. That's what gray matter is. It's the cell itself. Most of you know that brain cells have axons that carry the information to different parts of the brain. And there's some evidence that there's also damage caused to the white matter, which is how the information gets transmitted from neuron to neuron, right, or from different parts of the brain. And there's some evidence that you can get white matter damage as well as gray matter damage.
Absolutely. So as we see this, and as more research is coming out, that there's this idea of long COVID and what's going on with it. Another article that came out talks about some private companies that are taking on this challenge.
Right. It was interesting that we spent all week kind of looking at these articles and deciding which ones to use, and just as we're about to we're looking at the news this morning, and up pops this other article about and I was fascinated when I saw it. I said, long-term COVID patients in search of relief turn to private companies, and I thought, what is this about? And lo and behold, what it's about is we have this confusion. We're not sure how to deal with it. We have these big research centers attached to universities and large hospitals, and they're struggling. And people who have long-term COVID are trying to find relief. They're trying to find treatments, and the treatments simply don't exist. Right. So it's created a vacuum that private companies are filling.
Absolutely.
They're moving in.
Right. And so there is some federal funding that's been just a little bit, $1.15 billion or so to help fund studies to look at this, because again, the research is emerging, and so there's no known treatments yet. And so we need to find some treatments. And so they're funding some of these smaller companies, private companies, to figure some of this out.
Right. Yeah. So the problem is you have people, millions of people in the country who are struggling with these mental health and cognitive and symptoms, and they want relief. They're seeking relief. Well, first of all, the relief doesn't really exist. And even when it does, it may take months to get into one of the clinics. There's a clinic here in Lakeland that one of the physicians started, but there's a backlog, of course, because you have too many patients for the number of providers. So one is people can't access what few services do exist. When we get to the treatment itself, we run into all kinds of challenges with long-term COVID. First one is we don't even know how to define it.
Right.
What do we mean by long-term COVID?
Right. It's not a specific test for it. I mean,
no.
Yeah.
I mean, and we have every body system can be affected by it. So some people with long-term COVID have sleep disorders. Some have gut issues. Some have cardiovascular disorders. Some have cognitive. Some have mental health. And so what exactly do you mean by long-term COVID? Who has it? How do you know that you have it?
Right.
Okay. How do you diagnose? There's no diagnostic test for long-term COVID.
And because of that, there's no specific treatment. We don't have a thing to say, oh, this is how you treat that. So we still need to.
Right. And as we saw earlier, we don't know what really causes it. Is it the virus itself, or is it the inflammation? So there are many, many unanswered questions. Right. And the theories, of course, which we've talked about in the previous articles, is that it's there's something about the immune system that it identifies the wrong things and goes on the attack. It attacks good cells rather than bad cells. And the other study said that it activated. We've never talked about the Epstein-Barr virus. It's it makes you tired, essentially. It's like what causes mononucleosis. Another study found that the coronavirus activates the Epstein-Barr virus, which makes you very tired. Other studies showed that it's linked to type 2 diabetes, which would also make you tired. So all these links have been made, but we simply don't know.
Right.
There are theories, but we just don't have enough research to know.
Right. So even with the most some of the most highly respected clinics and
Right.
treatment facilities, the treatment regimen varies greatly, and from doctor to doctor, even within the same clinic, sometimes they're going to offer different strategies or different recommendations, and there's no, as far as we know right now, there's no cure. I mean, it's just we're trying different things, and
Right.
that's really challenging.
Right. And so what we're left with is you treat symptoms.
Right.
Okay, because we don't have a test. We don't have a diagnostic test. It's like many of the other mental health issues that we deal with. There isn't a diagnostic test for any of these things. And so you address symptoms, and you go for symptom relief.
Right.
So people are looking for these, and companies are beginning to emerge that claim to be able to treat it.
Right.
And one of these companies that they mentioned in this article is a company called Incell, INCELL Diagnostics, DX. And while it's easy to criticize these companies, I give this company credit because they at least made themselves available for the interviewer. Okay, so they at least they're not trying to hide anything. And what this company does, it begins with a blood test. And they use the blood to analyze for these proteins. And it's interesting, they don't do the blood test. They don't draw blood, because that's an invasive procedure, and you have to have permission to do that. So what you do is you have your blood drawn somewhere, and you send it to them, and they analyze it. And I wished I had a simple explanation for a cytokine, but I don't. But what they actually do is they analyze the blood for 14 immune system proteins that we know are associated with the virus.
Right.
Okay, so that makes sense. That we know these are associated. We'll examine your blood, and we'll say, okay, you have these that are called biomarkers.
Right.
We looked at your blood, and we looked at these 14, and lo and behold, yes, indeed, you do have these markers for having long-term COVID.
Right. And those markers, those system proteins or cytokines, they are ones that are specifically associated with some of the inflammation that we talked about.
That's right.
And, again, in cell diagnostic, they don't have any treatments. I mean, they provide some recommendations for treatments that you can go to your primary care to talk about. And they include just different medications and different things. But again, this is an emerging, our understanding of this is just emerging. We're just getting to it. And so there's still a lot of work to do. Right.
And so you have these, you have this blood test done, and you say, yes, indeed, you have it. And so what this company does is they recommend treatments, and the treatments are typically one of the medications we use for HIV and statins, which reduce cholesterol. And so they send those recommendations back to the person. So think of it, the person sends blood, they analyze the blood, and then they say, we recommend these medications. They don't prescribe those medications. What they do is they give them back to the individual, who then goes to their primary care provider and say, this is what they're recommending. And the primary care provider writes the prescriptions for the medications, okay? And so that's, the problem is that that's not the way science is done, okay? But the company is saying, hey, we're in a pandemic, people are looking for treatments, we'll do the research eventually, and the company is involved in some research studies, but they're saying, we're in the middle of a pandemic, people need relief right now. If this provides relief and does no harm, then let's go ahead and do it.
Yeah. I think that, and as we look at this whole thing, I think that it's fantastic, of course, that we are moving in this direction where we're, different companies and different people are looking for some strategies. And, there's some suspicions, of course, with private companies, because, are they just trying to get money? Are they in it just for the profit? And some of those things are understandable. But some of those companies are really in it to try to understand. And the more people that are looking at this, the better it is, because there's more ideas and there's more strategy. But I think that some of the problems, some of the things that we really have to think about is that, this is a vulnerable population. I mean, people with long COVID, they're struggling and they're battling. And so they're susceptible, they're vulnerable to whatever somebody says is going to work. And so, I mean, remember that it wasn't too long ago that people were taking medications intended for, horses and things like that, because they were just looking for something to help. And, so this population is very vulnerable to those kinds of recommendations. And so we have to be mindful that, we're not jumping the gun on something that could cause some harm that we're not anticipating up ahead of time.
That's right. So this company, when they go after these cytokines, they're going after inflammation. Right. I mean, that's what they're looking at. They're thinking, okay, this looks like an inflammation problem. So they're treating inflammation. The problem is that when they do, they've tested 18,000 people with people, and 95% are coming out positive. Yes, you have it. Well, of course, because they have the markers for inflammation. So that part's okay. The issue becomes, what would, if you tested 18,000 patients who didn't have COVID, how many of those people would test positive? Because many people had COVID and didn't know it. And many people didn't have COVID and may still have those markers for some other reason that's not related to COVID. I mean, it's not only COVID that produces those results. And so, but the problem is that takes time. Where do you find 18,000 people? Where do you find 5,000 people? And then who pays for it? Okay. So this is very expensive research that typically only the government can undertake. Because private companies don't have that kind of money. I mean, you're talking about billions of dollars when you want to do this kind of research, and only governments have the money to do that. And so the question, what has to happen is, we need random samples. Just take a group of people, period. Some did, some didn't, some young, some old, and test a group of randomized patients. And then the researchers have to do the treatments in a way that nobody knows who's getting what. That's called a double-blind study. Nobody knows who's getting a treatment. You don't know whether the medications you're taking are real or if they're just sugar pills. And so that takes care of what we call the placebo effect, that you just think you're getting better and you're really not.
Well, and as it relates to this specific research, you take a whole bunch, if you had 18,000 blood samples, half of them are from people who had COVID and half of them are people who didn't have COVID, but the people analyzing the blood have no idea. And so they have to look at the blood and, based upon the results of their tests, try to predict, this is the blood from a person who has long-term COVID, and this is blood from a person who did not have COVID, and to see how accurate they are. And that, again, as you said, that research is really difficult, because where you're going to get that many people who are just willing to say, hey, take a few vials of my blood and send it off to these researchers and see what they find.
And it may take several years to do that kind of research. Okay, well, so what this company is saying is, hey, look, we're in an emergency situation. And so I think of this as sort of battlefield medicine. I'd really like to use a scalpel, but all I have is a bayonet right now. And so I'm going to use the bayonet. And that's kind of what this company is arguing, is that, we know that we're taking some shortcuts, but there's a crisis and we're trying to meet the needs of these patients who are vulnerable, but they're also desperate. Okay, or they're desperate because they're vulnerable. And so they're seeking some treatment. And I thought about that as I read the article, because your first reaction is, oh, they're just in it for the money. They're being dishonest, they're being deceitful. But then I thought, if I was struggling with these symptoms, I think I probably would be tempted to try something, as long as it wasn't dangerous. And I don't think there's any danger involved here. As long as it wasn't dangerous, I'd at least try it.
Yeah. So, so, we still need a lot of research in this, and NIH sort of allocated $1 billion over the course of 4 years, from February 2021 until 2025, about $1 billion to research long-term COVID. And they're calling their research project Researching COVID to Enhance Recovery. And if you do the acronym, it's RECOVER, which is very clever. And they hope to enroll 20,000 people, but as of last week, they've only got, just over 1,100.
Yeah.
So we still need a lot of people.
Right. It takes time.
Yeah.
It's this kind of science takes a long time.
Right. And so if you think you're suffering from long-term COVID, if you had COVID and it's been months or it's been a long time and you're still experiencing some of those symptoms, get help. Look for some of these resources in your area. Look up this NIH study, the researching COVID to enhance recovery, and see if you can participate in some way so that you can get some information that's really cutting edge, because they're those are the folks that are really looking at it to manage it.
Right. You mentioned during the pandemic, people were taking things that were meant for farm animals and drinking bleach and doing all kinds of strange things. And there's a great likelihood that as people become more aware of this population of people with long COVID, that I suspect that you're going to get, we're going to see a lot of treatments being offered. You go on the internet and you're going to see all kinds of treatments being offered, most of which probably won't work. So we urge people that if you have these symptoms, if you've had COVID and have these symptoms, certainly seek help, but get reliable help. Get it from a reliable source. There are research centers around the country, all the major hospitals, and especially university-affiliated hospitals are addressing this issue. NIH is addressing the issue. So seek help, but seek reliable help.
Absolutely. So, all right. Well, I think that's it for today. We have links to all of the articles that we've talked about in the show notes, so check those out, and stay informed, and we'll keep you updated as we hear more information. So
right, yeah, I think we're going to hear a lot more about long COVID. I think that's what's going to that's one of the directions this whole thing is headed right now.
Absolutely. All right.
Good seeing you again.
Good to see you, man. All right. Until next time, stay happy, stay healthy, and forget to be afraid.